Hello, everyone, and welcome to the May 2025 episode of Voices of CFMA, Construction Financial Management Association's podcast featuring conversations with industry leaders, sponsored by Banger. I'm your host, Sal Marino, CFMA's Director of Communications and the Managing Editor for CFMA Building Profits magazine. Before we get in today's conversation, I just want to take a moment to acknowledge that May is Mental Health Awareness Month. Now, if you've been around CFMA or even this podcast for a bit, you know that this isn't just a calendar prompt for us. It's personal and it's real. Mental health touches every one of us in our families, in our teams, in our industry, and yet it's still something we tend to push aside until it becomes a crisis. That's why this month, and this episode in particular, matters. It's about reminding ourselves that checking in on each other isn't extra. It's essential. It's not about having all the answers. It's about making it safe for someone to say, I am not okay. Today, I'm joined by someone who's been doing this work for a long time, Cal Beyer. If you know Cal, you know he doesn't just talk about culture, he lives it. He's helped shape how the construction industry shows up for mental health and addiction recovery. Cal, welcome to Voices of CFMA. Can you start by telling us about your role?
Thank you, Sal. I am Cal Beyer. I'm the Senior Director for Safe Workplaces at national nonprofit Safe Project.
Excellent. So, for folks who aren't familiar with the core mission behind safe workplaces, how does it connect with what construction leaders are facing today?
Yeah, Safe Project as a national nonprofit has existed since 2017, and the mission is to make a tangible difference in the nation's overdose crisis. SAFE stands for Stop the Addiction Fatality Epidemic. And many folks will know the work that I have done started largely with CFMA many years ago on human capital risk management. But I brought to CFMA the need to launch mental health and suicide prevention. And I brought Dr. Sally Spencer Thomas with me to CFMA. And Sal, your predecessor, editor, Christy Domboski, had the courage to challenge the conventional wisdom that we don't talk about mental health and suicide prevention. And Christy convinced then CEO, president for CFMA, Stuart Binstock. So that was 2015 into 2016. And today, the mission of Safe Project is to continue to decrease the effects of overdose. So both alcohol and other substances. And the country has been faced in a 3-decade battle with opioids. So for construction leaders, this is a human capital risk management challenge, and it has an adverse impact on our company workers' compensation and employee benefits. It has a big impact on our workforce development and the morale and safety and well-being of our people and their families. This is a cause that everyone can rally around because we all are impacted. A very large percentage of individuals are impacted by the struggles with addiction. So we just want to help bridge that gap.
And that's a great goal. In construction, we talk a lot about the perfect storm, right? High pressure, remote sites, long hours. What's your read on how these factors contribute to the ongoing mental health crisis?
Yeah. And I think we have so many variables and so many factors. One that I think has often been overlooked was the degree of musculoskeletal injuries. And that contributed to that perfect storm by leading to overprescribing of opioids for pain relief. And the lack of paid time off in our industry meant people played through the pain. So there's data that shows up through 2020, opioids were still being overprescribed, and construction workers, about 55% of the time, were getting prescribed opioids. That was twice any other industry. And the duration was longer, and so was the dosage. So in many ways, Sal, you use that word perfect storm. It reminded me of dope sick. I felt like our industry was targeted because we had a work group supporting their families, feeling the pressure of schedule, being understaffed because of workforce shortage, and people trying to do the right thing and taking the advice of doctors dentists and surgeons that opioids would be the best pain relief, ended up with addiction. And then fundamentally, we can do better addressing the challenges of alcohol and finding ways to moderate the presence of alcohol at company sponsored events.
Yeah. And that vulnerability you're describing really underscores why we need a culture of care, right? You've written a lot about that in CFMA Building Profits, but what does it actually look like on a job site or in the office?
Culture of care is a phrase now that largely gets attributed to AGC of America.
Yeah.
They started their Culture of Care program in the AGC of Washington chapter, and the contractor I worked for was a member of that chapter out in Washington State. And I was there at the ground stages, and there they were really talking about how do we let people know that they're seen and heard and visible. So it was really building inclusion and belonging so people would feel respected and then valued and hopefully affirmed and recognized and given promotional opportunities. But beyond that, this people first culture is what I often call them. Our companies going a step beyond, and they're looking for opportunities to drive engagement with employees. They're seeking input, giving feedback, asking for an ongoing relationship with their workforce. And where you have that engagement and empowerment, you have a more motivated workforce. So you have less absenteeism, you have less tardiness, you have people showing up, ready to work, engaged in the work, less turnover, more productivity. It leads to a better morale, a better worksite culture. It starts this virtuous cycle. A lot of times we talk about the vicious cycles in that mental health crisis, but this caring culture sets the tone, lets people know that they're valued. And it's how we become and maintain a status of employer of choice. And it is a war on talent. And so I think every CFMA leader recognizes the importance of this caring culture.
People may be thinking, for companies with the resources, that cycle makes total sense. People feel valued, they stay longer, they show up, and they're more engaged. But let's say you're a smaller contractor without a big HR team or a wellness budget. What's a realistic first step toward that kind of culture?
For years, as a risk management and safety professional, we talked about safety is everyone's job. We need culture to be the domain of leaders, but we need everyone to become cultural torchbearers. So we need people to embrace that culture. And it starts with that leadership commitment. And so, on the side of mental health, for many years, I've taught 3 V's of leadership for a mentally healthy culture. It's being visible, it's being vocal, and then vulnerable. And those 3 V's became tangible, they became palpable.
Right.
When companies had those 3 V's present, you could feel it. There was something palpable. Employees felt psychological safety. They felt more comfortable disclosing that they needed help. In the absence of that visible, vocal, vulnerable leadership, people isolated, they withdrew, they didn't feel comfortable disclosing, asking for help. That's a sign of stigma. And stigma is this real but invisible barrier. And it keeps people from feeling safe. It keeps them from feeling connected. It has them feel isolated and alone. And people who feel isolated and rejected and alone frequently can lose hope. So to me, this idea of a caring culture doesn't cost anything to be kind and to be nice and to be professional and to just have that respectful civil culture goes a long way to having people want to be part of a team. There's so many more elements, but that's the fundamentals. And Sal, the cool thing on the 3 V's, I observed it in so many companies where that 3 V model was present. Where you had those 3 V's, a fourth V appeared, and it was vertical up and down the org chart. People started feeling comfortable sharing their story, sharing how they'd gotten help, how they found hope, And usually it was through a coworker, it was through a supervisor, it was through an organization like an employee assistance program or a community-based recovery group that the organization had brought in to give people help. And so often people were sharing how their family situation had improved. So if I've learned one thing over the last 10 years since we wrote that first article in Building Profits about mental health and suicide prevention, a lot of this was a lack of coping skills. It was a problem with stigma that kept people from seeking help. It wasn't all mental health, diagnosable mental health conditions. In some cases, it was relationship challenges. It was financial, legal challenges or crises. It was a car bill. It was an unexpected house damage claim where maybe they didn't have the right insurance and people needed help and support.
I kind of love that fourth V. It's like a bonus level that tells you you're doing something right, you know?
Yeah. And the one that really was so important was that vulnerable. So I would have a company leader say, that's just not me. I'm never going to be comfortable. Is there someone on your leadership team who is willing to carry that role? And usually there was someone on that leadership team who'd say, okay, then I'm willing to share my story because I want to help people. And when I would see that happen, it wasn't unusual within 60, 90 to 120 days. By the next quarter, someone else was standing up and sharing a story. Hey, if it'll help one person, I'm happy to share my story. And the respect toward colleagues who were making themselves vulnerable, we worried a lot in the old days that people would lose their privacy and confidentiality, and maybe there'd be some bullying or harassment. But what we saw instead was an understanding of you don't mock mental health and you take hope in someone else's recovery story.
And Cal, you've been writing and speaking about this for years. You talked about how this whole thing started, but what first moved you to focus on this work?
Now, I grew up in a family where we talked openly about mental health. Before my parents talked to me about the birds and bees, as the oldest of five children, they shared with me as you get closer to adolescence and puberty, bodies and brains develop and change. And we want to let you know that we have mental health struggles on both sides of the family tree. And so if you ever need help, we're here for you. We will care for you. We will always be available. And your dad has good insurance. So if you ever need help, it's going to be okay. So don't hesitate if you need help. As a firstborn, I was naturally stubborn. And when I went through a situation with a knee operation, and then a second, and then a third, I had prescription use, misuse, and then abuse. And it took courage to make that change. And what I learned in that experience is if it could happen to me, it could happen to anyone. So never judge someone. Sal, I didn't always tell that story because I was afraid it would doom the whole mental health movement I was trying to lead. I didn't want people to say, well, he had addiction issues. He's not even credible. So I just kept that silent. So that was my formative childhood years. And I did work in healthcare through high school and college. And I recognized I didn't have the temperament to be a doctor. I established really close and deep bonds, and I have a hard time letting go. So when I help people, I stay overly involved. And what happened in that regard was I went to get a degree in city administration. I thought I'd be a city manager. And along the way, I discovered police, fire, public safety. And they opened up to me and they started seeking help and they formed peer groups and they helped one another. And then I moved to the construction industry in 1996. I'd finished a suicide prevention project in the workplace from 1992 to 94. And as soon as that ended, someone said to me, dude, if your mission in life is saving lives, you should go to construction. They killed 1,500 people last year, and that was occupational injuries. So we moved from Chicago to the East Coast, and then post 9/11, contractors working side by side with first responders. And I was mentored by an amazing leader. He's helped write several articles and he's spoken at CFMA with me. His name is Bob Vanderpool. And he taught me psychological first aid, how to address the emotional needs of employees in the aftermath of traumatic experiences. And when Hurricane Katrina hit, my first article with Building Profits was in 2005, and it was called Emergency Preparedness and Disaster Response. And over the next 4 years, I spoke at over 65 chapters or regional conferences or the national conference. And Sal, then what happened as I taught people how to take care of people when bad things happened, I heard hundreds of stories at those conferences or events, people sharing with me struggles in their family, usually after something bad, a fire, a bankruptcy, a divorce, a sudden death. We started hearing about these mystery deaths, suicides. Some happened to be overdoses. In 2010, I was appointed to the National Action Alliance for Suicide Prevention. And by 2012, I was starting a construction subcommittee. And I met Dr. Sally Spencer Thomas, and we started collaborating on the workplace task force. And we started doing summits after we did the article for Building Profits. And CFMA helped us do about 20 summits in the next 4 or 5 years.
Wow, that's amazing. Speaking of CFMA, with May being Mental Health Awareness Month, like I mentioned earlier, some members might be looking for small ways to mark the occasion. Is there one thing they can do right now to get started?
I would say, please look at the Construction Industry Alliance for Suicide Prevention and look at the safeproject.us website. The executive director, Sonia Bowman, I know she's been a guest of yours in the past. Sonia and I partner often, and that's an organization that CFMA helped start back in October of 2016. And I feel like there's something on that website that can help every organization help at least one person. On the Safe Project website, we have a tool called the No Shame Pledge. And I would just challenge leaders to download that pledge on the Safe Project website. If you enter your name, it'll print you a form. It'll email you a form that you can print and make your posting in your office. You can share it in a selfie online that you took the No Shame Pledge. Let people know that you're safe to talk to about mental health and have that conversation at home. Those would be the simplest ways to start. Visit www.preventconstructionsuicide.com, Safe Project US, and have a conversation with a friend at work or a family member. Ideally, do both. And you'll be so happy you did that you'll start sharing information about 988, the 3-digit crisis and suicide prevention lifeline. And then you can go to the next level, both on Safe Project and on this Construction Industry Alliance website. There's additional resources, ways for you to cascade information to your employees. But it starts with a single conversation.
And we will have links for everything that Cal mentioned in the comments and description section of the podcast. Cal, out of everything you've been part of over the years, are there any moments that really stuck with you where you felt like, yeah, this is working, we're actually moving the needle?
Wow, Sal, that one is such a loaded question. There were a lot of turning points, but not tipping points. And one turning point was calling mental health and suicide prevention the next frontier in construction safety. For many years, we were feeling a lack of support and even some resistance from HR and employee benefit directors. They were being advised by legal counsel: mental health is a slippery slope. Maintain privacy and confidentiality. It's too risky to talk about it. So I had no choice but to go to my safety and risk peers to say we don't allow people to operate vehicles when they're fatigued or impaired. We don't allow people to work from heights when they're not feeling well. This is a risk management and a safety. It's the next frontier. There might not be a standard for it, but it's how we exercise care and due diligence for our people. And we had some buy-in. In 2015, the next turning point was if we believe we have a safety 24/7 culture, it's not enough to get people home safe at the end of a shift. If we really have a safety 24/7 culture, we got to get people back to work safe from home. And that was the idea of safety doesn't have a clock. People
Right.
are struggling in silence and suffering alone. And if we build a safety net in the workplace, we can help bridge that gap. So then we spent time teaching them about employee assistance programs, how to tap their employee benefits. HR got on board. But another turning point was that first summit, and that was in Phoenix, and then Portland, and then Charlotte. And we started to see this ripple effect, and it was like, dang, it's happening. We're breaking down the barriers, breaking down the stigma. People are learning, they're engaging, and they're being empowered to go take action. And Sal, we did first year post pandemic, the first of we've had 4 mental health summits for
Right.
construction: Denver, Kansas City, and then Dallas. The 5th annual will be held next February 23rd to the 26th in Portland, Oregon. And we would encourage more CFOs to get involved. And if not you, then get someone from HR and safety in your company to attend. This has become a community of learners who are devising the next innovations, the next communication method, the next tools, resources, and it is having a profound effect. So those are some of my favorite memories. This past year, I got to do a keynote on overdose prevention. And then I got to do a panel on recovery ready workplaces. And then I got to do a breakout. And to see people ready to talk about substance use, misuse, and then treatment and recovery was so healthy to see the dial move. People were not afraid. They were actively participating and saying, hey, this is how we're going to save more lives.
That's so great. So, Cal, what do you think is next? Are there emerging trends or resources that you think will shape the next wave of mental health support in construction?
Val, we're right on the cusp. A couple of years ago, we did an article on recovery ready workplaces. And persons in recovery experience a lot of discrimination. Maybe from their struggle days, there are gaps on their resume. Maybe they had a DUI, right? And are going to be worrisome from an insurance standpoint. And the discrimination is faced both at time of hire and then once they're on staff, they get passed over for promotions. This idea of recovery ready workplace is to provide support for persons in recovery with a substance use disorder, but it's also a great way to recruit new talent to organizations to expand your pipeline. The loyalty effect is huge. Persons are grateful to have another opportunity and a next chance or a better chance at employment and fulfilling and finding a purpose in their career. So one future trend is we're getting smarter to teach people to be open-minded about hiring based on merit, and this idea of recovery ready workplace is coming of age. And that article in Building Profits is one to share. It was written with a clinician, it was written with a person in recovery, and it was practical steps. And it talks about the stages of recovery, and there's multiple pathways to recovery. So that's the second trend. Back in the day, especially in industries like construction, we only talked about abstinence based, but there's evidence that other pathways to recovery can be effective as well. And there's not just one pathway to recovery. So this idea of moderation management is another method. There's another model called smart recovery. So people would be wise to engage with a community-based recovery organization. Look at what's happening with peer support specialists. That's the next outgrowth. So there's 3 or 4 of these pathways that are all converging, and great things are starting to happen. I'm really excited. I'm smiling because finally we have hope to help families and workers. It'll take courage among early adopters to make that happen.
Cal, this has been fantastic. Is there anything you'd like to say before we sign off on this episode?
Yeah, I want people to think about we have a lot of emphasis on drug-free workplace policies and drug testing protocols, but do they help people? Do they only reinforce stigma? So I want people to think about how do we give more resources to people who are struggling or their families are struggling with addiction treatment and recovery. A lot of times, Sal, 80% of companies tell me they are, but when we look at when they communicate or how they communicate, it's after someone refuses a drug test, fails a drug test, gets a motor vehicle infraction, or has an emergency room visit. And then it's a crisis, and then we're not prepared. So we need to understand our employee assistance programs. We need to understand and help people navigate the employee benefit process. Don't just give them a number to call. Roll up your sleeves, sit with that person, help them navigate, and explain to their family what options exist. So that's the last thing. Just how can we take care of people before it's a time of crisis? Educate them, share information, give them access to information. And if we educate and equip people, then we can empower them to take care of themselves. And that's the essence of those positive mental health and recovery conversations.
It really is the essence. And I think the way you talk about care, not just as a policy, but as something you practice person to person, that's what really sticks with me. And honestly, I'm just grateful for the way you've stayed in this work and kept pushing the conversation forward in our industry. So, Cal, thank you so much for taking the time to talk with me today. This was incredible.
Thank you very much, Sal.
And thank you all for listening to another episode of Voices of CFMA, sponsored by Banger. If you enjoyed this podcast, don't forget to like and subscribe and share it on social media. And if you're interested in learning more about the Construction Financial Management Association, check out cfma.org. Once again, I'm your host, Sal Marino, and I will see everyone back here next month. Thanks.